My dad was a dentist, and he graduated from Loyola University, Chicago College of Dental Surgery, when it was right over here on Harrison and Polk, and Harrison and Wood, actually. And that goes back to the class of 1937. So I have a long history of loving the science of dentistry. I went to Loyola, and I was class of 1989, and I was assistant professor there for many years. I maintained my academic status in academia by continuing with teaching emergency medicine over at Christ Hospital. I teach the EMTs and paramedics. I'm involved with what is known as the Dental Arts Club, which is a smaller group dedicated to doctors who are of Polish descent. There's a transition from the didactic portion, preclinical, to when the students come into the clinic. So they may know all of the technical details, but then getting them to translate that into manipulating their hands in an effective manner, that is where I really get my joy and my payment as such, because I'm showing them little tricks and tips of how to do things, and when they realize that's what it is, it's like fantastic, and that's just such a warm feeling that I was able to instill in somebody the skill from my hands, transfer it into theirs, and knowing that the knowledge which I have transferred to them will move on to generations and generations of future students and dentists. We've learned a lot through our years of dental school, but it's the actual practice of dentistry with the addition of keeping up with the times, the cutting edge. We learn an awful lot in dental school, but even since I've graduated, there have been so many new cutting edge events, techniques, and it's so important that they keep up on this. The biggest thing, I think, is we are treating the whole body. So our doctors that we educate today do not need just to know what a class 2 amalgam or resin restoration is, but they have to know that when they place that, during the process of placing it, they are administering medications to these patients. It's not uncommon for a patient to have 5, 10, even 15 medications that they take. So our newly formed doctors have to know not only the physiology and the biology, but also the pharmacology of these different agents that are used so that no harmful interactions occur. So it is amazing with this technology. We are so lucky that we can look things up in electronic PDRs and ERXs. It is such a boon to keeping the whole of the patient safe and comfortable. It is just a wonderful experience to be involved in not only organized dentistry, but in the educational process. As I said, I've been in education all my life, and I hope to be doing it for the rest of my life as well.